Hi everyone, I'm Ashley with 9 Health, and this is Health Happens, our weekly Facebook Live show. And because we know that health is happening all around us, to each and every one of us all day, we want to give you the information that you need so that you can own your health. And today we are at the University of Colorado Skaggs School of Pharmacy. We have Sunny and Connie. They're both professors here at the school. They teach pharmacy students all about medications and everything. We were actually just sitting here talking, and we realized how much there is to share on this topic. So we're talking about over-the-counter drugs, prescription drugs, and everything that has to do with that. So if you have any questions, feel free to chime in down there in the comments, and we'll let Sunny and Connie take it from there. But while we get this shared on some other pages, I want to talk to you about last week's episode. We actually, our communications team, each shared the different ways that we're eating, our eating plans. Some might call them diets. I like to say they're not diets, but if you're interested in learning more about different ways that you can form your eating habits, check out our episode last week. We had a registered dietitian weigh in, and it was pretty interesting to see what she had to say about what works for some may not work for others. So check that out. But let's get cracking here. Like I said, we were just talking before we started, and there's so much information out there. But I think we need to start with the basics first. So what is an OTC and what's a prescription? What's the difference between those two things?
That's a great question. Over-the-counter medications are, by definition, over-the-counter. So patients can pick those up themselves, either at the pharmacy or the grocery store. Sometimes those are also available even in a gas station. And over-the-counter medications are regulated differently in the United States than prescription drugs. We also have prescription drugs, which are provided at a pharmacy only, and those prescription drugs can be going through a lot more regulatory type studies to make sure that they're safe and effective, whereas the over-the-counter medications, they may have gone through some of those studies or they may not have. And supplements are included in over-the-counter medications. Those are completely unregulated for the most part, such that we don't even necessarily know that what the label says is what's actually in those pills in the bottle.
Interesting. Okay, and if you're just joining us, we are here at the University of Colorado Skaggs School of Pharmacy. We have Sunny and Connie. They are professors here at the school. So that's what I think is so interesting, is that the perception might be that just because you don't need to have a doctor's permission to buy this drug, that it's safe, and that's not always the case. Or not that it's not safe, but you need to be careful about how you use it.
Exactly.
Is that right?
I think that's one of the biggest concerns, is that people pick up medications and they don't look at what medical conditions they have. Is it safe for them? So it's safe for most patients if you take the doses as recommended on the box, but a lot of things interact. So cough, cold, flu medications come to mind, and allergies. So the decongestants like Sudafed is a common one that we see, which is pseudoephedrine. That interacts with a lot of conditions. So it constricts the blood vessels. So when patients have high blood pressure, or if they've had a heart attack, or if they have diabetes, or if they have thyroid, or glaucoma, or prostate issues, it interacts with all these different conditions. And patients often will not realize that it has an interaction.
So something we're probably going to say over and over again in this episode is you need to talk to your doctor. You need to talk to all of your providers and share all of the things that you're taking.
Or at least talk to the pharmacist. Go to the pharmacy counter and say, is this safe for me? Just because it's over the counter doesn't mean it's going to be safe and appropriate for the patient. So I'd say go to the pharmacist at that point when they're selecting a product.
Excellent. And you both teach about OTCs to different age groups. Is that right? So there's like different risks based on those age groups. Can you tell me a little bit about that? And Sunny, you do geriatric, right?
Geriatrics, yeah. So my area of expertise and where I practice is in geriatrics, which means that we help take care of older adults. And what Connie and I really focus in on in class is the age spectrum. A lot of the over-the-counter medications may be safe for people in the middle of the age spectrum, but the risks can definitely increase for older adults, which we typically define as over 65 years of age. And then young children, kids less than 6, for example, those patient populations are going to be at a higher risk often for side effects of medications that are over-the-counter.
Okay. And that's your specialty, right, is the pediatric side of it?
Well, that's what I teach in class. So I work in a primary care and family medicine clinic. So we see peds up to geriatrics. So
And what we like to think about too is, so you might be taking 2 different over-the-counter medications, but they can always maybe not be a very good combination. And something that always comes to mind as a visual is, have you seen like when they put the Mentos in a Diet Coke? Like two pretty simple things, but when you put them together, they're explosive and really not a good combination. So kind of the same thing with over-the-counter medications. It might seem like they are okay together, but sometimes you just need to always check.
Right.
That's just the rule of thumb, right?
Definitely.
So double
And
check.
in addition to the medications potentially interacting, the over-the-counter medications, they can also interact with prescription medications.
Yes.
And they can interact with conditions that the patient might have. So, for example, older adults are at much higher risk of having cognitive impairment or memory problems associated with drugs like Benadryl. So, Benadryl may seem harmless and safe for a lot of people for allergy treatment or for an allergic reaction. And one dose may be okay if an older adult takes it. But if an older adult takes Benadryl regularly for their allergies, that's really going to put them at risk for memory and cognitive impairment, amongst other side effects.
And with allergy season coming up, or maybe we're already in it, what could you recommend as far as selecting the appropriate allergy medication?
Well, we talked about Benadryl, and we have other agents which are more, they cause more sedation or be more tired. So those, although they work for allergies, they get into the brain more than the newer agents. So the newer agents are like Allegra, Zyrtec, Claritin, and those don't cause as much sedation or sleepiness. But the older ones, like the Benadryl, we see those a lot in sleep aids as well. And those are the ones that you probably don't want to take on a routine basis, just because it makes you, studies have shown it's actually impairs the brain as much as alcohol.
Oh, wow.
So the newer agents for allergies are more effective. Now, that being said, when people take these medications for colds, the newer agents aren't going to be effective for cold symptoms. It's only effective for allergies. And that's because the side effects that Sunny was talking about, where it causes like dry eye, dry nose, dry mouth, the anticholinergic, those are associated with the older meds. And so you'll see a lot in like cough, cold, flu medications, because you want the drowsiness to help you sleep, and you also want it to dry up the runny nose. So they're not quite equal. So for allergies, I'd go with the newer, the less sedating medications. And even the nasal sprays, they have the like Nasacort and Flonase. Those are nasal steroids, and they are very effective.
I love Flonase.
So it helps with nasal and eye symptoms.
And so in my mind, I'm thinking, this is so much information. This is complicated. That's why you're here, and that's why this building exists, is because we have professionals that can help us. We don't have to come up with these answers ourselves.
That's right.
As just regular people. We can always call upon you, the pharmacists. And that's another thing, too, with the 9 Health Fair season. We are in it, and a lot of our sites have Ask a Pharmacist booths. And so you can go talk to someone like Sunny or Connie and say, here's my questions. I'm taking this. What do you think? And so if you're having these questions, feel free to find one of our fairs. I think we have about 50 fairs that are offering the screening, and so a great resource to you this spring if you have any questions about that sort of thing. Another thing that I think is important to bring up is that some drug combinations can maybe reduce the efficacy of the drug. So maybe you're taking like an oral contraceptive, and that can be affected by another drug that you're taking. Is that right?
Interactions happen, like medications are either metabolized through the liver or eliminated through the kidney. So we have a lot of ways that they can interact. So,
just another reason to share all of your medication with
a good example, Coumadin, which is a blood thinner.
Or warfarin is the generic name.
Okay.
I had a patient who came out of the hospital who was on warfarin, and his son-in-law said, you need to take these supplements. So he began these supplements, we tested his blood, because you do it through a lab test. And we test the INR to see how thin the blood is. And his INR was the highest I've ever seen a patient. And it was because of the interactions with the natural herbal supplements. And we had to send him to the hospital.
Really?
Yeah.
Because of something that he can purchase himself at a grocery store or whatever, that's seemingly safe. And tell us again, the supplements are not regulated, is that right? So that's one of those, not dangers, but you want to be aware of that, is that you may not know what you're getting exactly.
That's right. There is one way that we have to help us know that at least the drug that's in the bottle or the medication is what it says it is on the label, and that's the symbol that says USP. So the USP label is symbolizing that the U.S. Pharmacopoeia has certified that medication as being, the ingredients are correct. There are not adulterants or other chemicals that were added in there, and that the medication will dissolve appropriately if someone took it orally.
Okay.
So the USP label is something that the company has to pay for. They have to pay for that testing.
Okay.
And so many companies do not pay for the testing, and especially if they were putting in other chemicals, they wouldn't want to get caught with that testing. So so we look for, as a pharmacist, you'll see sometimes on the shelf there's a brand like Nature Made, for example, or the Kirkland brand at Costco. Those are brands that are more reputable and actually have done the testing and paid for USP to certify their products.
So that's something good to look for, is that USP label.
And this is important because you could get melatonin for sleep, and if it's not USP, sometimes what they do is they take Ambien, which is a controlled substance for sleep, and they put it into the melatonin so it works.
Interesting.
So then that way you come back and you get that brand.
You want it.
Because it works well.
Very
and it's because it
interesting.
has actual medications, prescription medications in there.
And that's very common, where the medication, we call that adulterated, that they included prescription drugs, for example, in the composition of the supplement. That can be very common, especially from medications coming out from outside the U.S. So when we look at the overall perspective on how many medications are coming in from other countries or from the U.S. that have these products with prescription drugs adulterating them, we are often seeing the most common being ones for erectile dysfunction or impotence, and then also medications to help with weight gain or muscle development. Those are the most frequently ones that we see that are recalled, and actually the FDA at that point, they will get involved and they will say these have to come off the shelf.
Okay. And when we talk about herbals, are those different than supplements?
A little bit different, yeah.
And what are your thoughts on herbals?
Herbals are also not regulated. So I think, there are a few medications that are over the counter that I think we have a little bit more data to support their use. So for example, melatonin, we have a little bit more data to support its use. Glucosamine, we have a little bit more data. Vitamin E, herbal supplements typically are combinations, and they may not have the one ingredient that we have any studies to support their use. So I frequently avoid recommending herbal supplements to patients, or I try to at least make sure they understand the risks, because all of those combinations of herbals in that particular supplement could have different risks. So that's something to think about.
Do we have a question?
We have a comment.
All right.
Sam says, more than any other state, I find that hard to believe considering the population of other states compared to Colorado. OTC meds are not being confused with vitamins and supplements, I hope. I think he's wondering if in your study did you include vitamins and supplements. I don't know.
And the study you might be referring to is when people in Colorado take more OTCs than others in the research that you did.
Yeah, so in that study in particular, we were looking at all over-the-counter medications. So that would be vitamins, minerals, supplements, herbal products. And we were particularly focusing in on California versus Colorado, and the Coloradans had higher use of over-the-counter medications than California, not necessarily other states. So I hope that wasn't the way it was written.
It
Sorry.
was.
Okay, we'll update that to say versus California.
Yes.
Yeah. Well, and that's interesting too, because you might think Colorado's a pretty healthy state, or we have that healthy lifestyle that kind of going for us, and so taking vitamins and taking supplements might give you the the feeling of a healthy lifestyle, but we were talking earlier too that it's your diet can go so far with what you're through fish and through different things you can eat can actually have the same effect as supplements and herbals. Is that right?
Or even a better effect. I mean, honestly, when I look at the data to support supplements, and then you look at the data to support a healthy lifestyle through diet, the dietary studies are much more impressive than the supplement studies. Okay. So, for example, eating fish is, and specifically certain fish, fatty fish, is a better choice than taking fish oil supplements for most people. Eating calcium in your diet is typically safer and better absorbed than taking calcium supplements if you're not lactose intolerant, for example. And then we want to try to eat iron in our diet, eat vitamin D in our diet if we can. We want to eat vitamin C in our diet, not take those in a supplement form.
We want all the vitamins.
Yeah.
And I see when we do brown bags, we'll go to like nursing homes and do some brown bag events where we go through all the meds.
Oh,
and it's
they bring them in a brown bag.
Oh, okay.
That's
Okay.
called a brown bag. And it's amazing how many supplements patients often have. So if you have a healthy diet, most patients don't even need a supplement.
Sure.
But maybe a multivitamin is adequate. But they might have a multivitamin, and then they might have eye bites for if they have any kind of macular degeneration. And they may have a B complex for energy, and they may have calcium, vitamin D. And so just the excessive amount of vitamins, most of the time you just pee it out, right? If you don't, the water soluble, you will just eliminate.
Okay.
But the fat soluble, it will stick around in the fat. So that's vitamin A, vitamin D, vitamin E, and K.
Okay.
And so those can be toxic at high levels.
Interesting.
And so that's why most patients probably don't need as many vitamins as what they're taking.
Yeah. Interesting. And so if you were looking to take a vitamin, if you just felt like something you wanted to include in your daily routine, you recommend a multivitamin.
A multivitamin.
That sounds pretty good.
We have certain populations, so pregnancy, they would need a prenatal because they need a little bit more folic acid.
Yeah.
And they need a little bit more iron and calcium. And then again, if you have conditions where the eye doctor says you've got macular degeneration, they might need a special eye vitamin, but otherwise, a multivitamin should be adequate for most.
There are a few exceptions. So, for example, if someone's had gastrointestinal surgery where they are not absorbing any dietary vitamins, then they have to take higher dose supplements because they have to take enough to be able to absorb those vitamins. So there are some other examples like that. Or vitamin D, for example, we all are trying to protect our skin with using sunscreen, and especially in Denver where we're at high altitude and there's so much sun, we need to use sunscreen and not really rely on our bodies making vitamin D through the sun quite as much. So in some cases, people may need to take a vitamin D supplement or get it in their multivitamin so that they have adequate vitamin D levels. And there are a few other cases. For example, older adults often are more likely to have vitamin B12 deficiencies, where about 10% of older adults will have that, and maybe even higher likelihood if they're on certain other prescription or over-the-counter medications that can contribute to it. Those patients may need to take a supplement of B12.
Okay. Well, and if you're worried about your vitamin D levels, your vitamin B12 levels, there are those screenings offered at 9 Health Fair. Every single location does offer those blood screenings. So if you want to figure out where you're at, what your baseline level is, that's a great place to go. And while you're there, if you have any other issues or concerns about some deficiencies that you might have, you can talk to a pharmacist there, or even just a medical professional can kind of give you some basic information about that. So a good place to go if you're feeling overwhelmed or confused about all this information. 9 Health Fair is a great place to go. You can find a location at 9healthfair.org, and you can search for particular screenings or just show up at any of the fairs.
And one thing about the 9 Health screenings,
these two both volunteer at 9 Health Fairs, so thank you.
So we do bone health. And
Yes.
we'll test the density, do the screening to test the density of the bones. And then we'll go through and look at, the workout, what physical activity. We'll assess how much calcium you're taking in a day, and we'll go through that and do a quick assessment. What should you be taking? Are you getting enough calcium and vitamin D? Does it look like it based on the diet? Your body can only absorb about 500 to 600 milligrams of calcium at a time.
Okay.
So when should you be timing that? If you're eating, having a glass of milk and cereal and then taking calcium on top of that, your body's only going to absorb so much, and it can cause constipation. So we'll do a full assessment
I like that.
at the 9 Health Fair too.
That's the
with the
beauty of
bone
it. You'll take care of the patient as a whole. Look at their whole lifestyle. That's awesome. Well, if you have any other last minute questions, we're going to wrap up here, but this is the kind of information that you can get at a 9 Health Fair from experts like this. And so if you have any questions or you just need to go find some resources, 9 Health Fair is a great place to go. Any last thoughts, Sunny and Connie, about all this information? It's so great. It's so good, and I'm glad that you're able to share your information with us.
I just want to say thank you for bringing this topic to the attention of the public, because I do think that we tend to think about over-the-counters and supplemental medications as being safe for everyone, and that's why they're over-the-counter. But that's not always the case, so it's really important to think about the risks and the benefits of over-the-counter medications, and to make sure that someone is assisting, a medical professional, a pharmacist or a physician, for example, is assisting with the review of those over-the-counter medications.
Yes, absolutely.
And I would just encourage anyone who's looking at an over-the-counter, especially if they have other medical conditions, or fall into the very young, very old, consult with the pharmacist at the time that you're selecting a product, because they can help select a safe and appropriate option at that time.
Absolutely. It doesn't hurt to ask.
Right.
No dumb questions when it comes to pharmacy. Well, thank you so much for watching, and thank you, Sunny and Connie, for joining us. And join us next week on Health Happens. We're going to be talking about mental health and some new apps that are available to help you with your mental health. So thanks for joining us, and have a great week.
Thank you.
Thank you.